So good morning. Lieutenant Governor Polito and I are pleased to be here today at Fenway Park, and we want to thank Sam Kennedy and the Red Sox for hosting us here. I also want to thank everyone with the Red Sox organization and with CIC Health for their tremendous work in setting up this mass vaccination site. Before getting into more details on the vaccination efforts here, I want to give some quick updates on the Commonwealth's COVID-19 data and vaccine effort. Yesterday, the Department of Public Health reported 1,963 new cases out of 61,265 new tests. At this point, over 13.7 million total tests have been conducted here in the Commonwealth, which is a massive number, which is why Massachusetts is a national leader in testing. 1,631 individuals are in the hospital, 353 are in the ICU. This represents very significant progress since the start of the new year. Hospitalizations are down 31% since they peaked on January 4th, and the number of patients in the ICU has decreased by 20% since the number peaked on January 12th. On vaccines, as of Monday night, 654,104 doses have been administered to residents, and over 1 million doses have been shipped to providers across the Commonwealth. Despite some snow, the vaccine effort carried on as planned, and for the most part, the sites worked well throughout the day. With respect to Fenway, the mass vaccination site here launched last week and officially opened to the public on Monday for all eligible groups. So far, 1,200 doses have been administered, and we expect about 500 doses to be administered per day this week, and we expect Fenway will ramp up to over 1,000 doses a day next week, and for the week after that, 1,250 doses a day. Sam was making noise about even more than that at some point down the road. But we expect that this site certainly should be able to ramp up to doing about 8,000 doses a week in the not-too-distant future. This week, the crews running the site did a terrific job of working throughout the winter storm on Monday, encouraging people to visit Fenway earlier if they could, and if they had late afternoon appointments. And anyone who needed to reschedule their appointment was able to be rescheduled for later this week. Fenway is the second mass vaccination site launched here in the Commonwealth, and we expect to have at least 7 mass vaccination sites across Massachusetts in the not-too-distant future. At Gillette, 23,000 doses have been administered, and in Springfield, which opened last Friday, 2,741 doses have been administered, and the mass vaccination site that opens today in Danvers, we expect will do 500 doses today. In collaboration with the City of Boston, the mass vaccination site at the Reggie Lewis Center opened earlier this week, and that site's currently serving residents of Boston, but will transition at some point to a mass vaccination site by the end of the month. We'll have more details to share on other mass vaccination sites soon as we continue the rollout. For people seeking appointments, we encourage you to first check out the mass vaccination sites if you're able to get to one. The sites are highly efficient, and they have the capacity to do hundreds and in some cases thousands of shots a day. Each Thursday, new appointments will be available for the mass vaccination sites, and this week, over 55,000 new appointments will go live for the following week at the mass vaccination sites. And we expect this number to continue to grow each week as the sites ramp up capacity and as more mass vaccination sites become available, and hopefully as we receive more vaccine from the federal government. There are also appointments available more regularly at smaller sites across the state. For appointments at other sites, pharmacies including Walgreens and CVS Health post appointments daily. That totals up to about 15,500 slots per week. Retail business pharmacy sites at Stop and Shop in Hannaford and Topco sites, including Wegmans, Big Y, and Price Chopper, post about 4,000 appointments every week. And other appointment sites, including healthcare locations, local vaccination sites done with the Board of Health, will also post somewhere in the vicinity of 55,000 to 60,000 appointments over the course of this week. Overall, that's about 120,000 new appointments that are being made available over the course of this week. and we'll continue to add to that capacity as we go forward. For people seeking appointments, everybody should understand that it may take several weeks in some cases to schedule an appointment. Please be patient and recognize and understand that everybody who's eligible during each particular phase of this will get an appointment and an opportunity to get vaccinated. It's going to take some time to get through our priority groups due to the limited supply of vaccines that we receive each week from the federal government. And while that supply is limited, we're working to rapidly increase our infrastructure to be able to vaccinate people so that we'll be ready when more vaccine becomes available. There are currently about 125 operating vaccination sites in the Commonwealth, and we expect to have 165 sites available by the middle of the month. This is obviously an ongoing process, and we're also working to add more sites in some communities that have been particularly hard hit by COVID. At this point in time, there are about 50 community health centers that have sites that are up and operating and vaccinating their patients. We're also opening up 2 new sites in, Walgreens is opening up 2 new sites in Mattapan, 2 sites in Roxbury, site in Dorchester, Chelsea, Revere, and Everett, and a community vaccination site also opened in Brockton, which is being run by the local Board of Health. Next week, we expect an additional 30 pharmacy sites. We'll add around 21,000 appointments, primarily for communities that have been disproportionately impacted by COVID. In addition to the big sites like the one here at Fenway, we're partnering with local boards of health, community health centers, and pharmacies on a variety of strategies to make sure that we cover more ground here in Massachusetts. The strategy here, obviously, is to try to make sure that in many communities that have been hard hit by COVID, we have familiar and trusted providers available to them to provide them with the opportunity to get vaccinated. The vaccine's safe. It's been through the same trials that all vaccines go through, and it doesn't contain the actual virus. Millions of doctors, nurses, and medical professionals across the country have already received both doses, and we hope that by partnering with all these different sites, people can get the safety message that's associated with this and hopefully have an opportunity to discuss it and receive that message from a trusted medical profession, and in turn make the decision to get vaccinated themselves. We know the sign-up process for vaccinations has been frustrating, and we're working to make improvements with respect to that. We updated the website this week to add eligibility checkers and the ability to search by zip code to find a site that's open and available to you. And we're working to stand up a call center, which we'll have more to say about later this week. More sites and new appointments are being added regularly to the map at mass.gov/COVID vaccine, so people should feel free to check that as we go forward. We all know that vaccines are a big part of the way out of this pandemic, and it's good to see that so many people want to get a vaccine. But since there's currently a limited supply, it's important that we manage our process and try to see if we can't serve the people who are most at risk first. And it may take somebody a few weeks to get an appointment, but the vaccines aren't going anywhere, and they will continue to come to the Commonwealth, and we believe in greater numbers over the course of the next several months. I think many of us are waiting to see what happens with the EUA application, the emergency authorization application for J&J, which would obviously put another vaccine into the mix from a manufacturing and distribution point of view, which would then add additional capacity to the national distribution system. We'll keep working on expanding sites like this and working with our colleagues in local communities and with local provider organizations to continue to expand their capacity. And we will continue our program to roll out vaccines in congregate care settings, assisted living facilities, senior housing, and other sites where in many cases some of our most vulnerable residents reside.